Hello everyone. Now I'll be starting about lipid. Lipid is a very important topic for every exam in the world. So I'll be doing in 4 parts. In the part 1 I'll be talking basically about metabolism of the lipid. It will be again a integrated approach, and there are so many things which are related to lipids. So I'll be covering all these for lipid. First of all, I'll talk about lipid metabolism. Well, it's a beautiful slide and it is there in all the books, and in fact it gives the whole metabolism including carbohydrate, lipid and proteins, including ketones also. But we don't need everything at the moment, so I'll focus what we need for my today's talk. For today's talk, you can write down, we have this glucose, G for glucose, and after various steps what is made is acetyl coenzyme A. What we write as acetyl CoA. Acetyl CoA. Well, this is from glucose metabolism. Now this acetyl coenzyme is the keyword. Now what happened to this? This goes, once it reaches become acetyl coenzyme A, now it can go into two pathways. That means it has got two routes to follow. Route number 1, route number 2. It can go to either of the route. This route number 2, this from this it makes citrate. And this go into TCA cycle, well known and very important for the glucose metabolism. Okay, but today as the talk is lipid, so we don't talk about route 2, we talk about route 1. So in route 1, what is formed? It makes it again divides into two parts. So now this route 1 divides again, bifurcate, route A, route B. So I can say in a day-to-day example, if I had to give you, so the acetyl coenzyme A, that turned toward road number 1. But the moment it goes to road number 1, soon it finds the road number 1 again bifurcate into two roads. One name is road A and the other is road B. So we are concerned with these two roads. Okay. So in the road number A, this acetyl coenzyme A, it become malonyl coenzyme A. You can write, now it is written here also. Now it is easy. So it make malonyl coenzyme A. Route number A I am talking about. But this step need B. This B stand for biotin. This B stand for biotin. Okay. So with the help of biotin, the acetyl coenzyme A is converted into malonyl coenzyme A, and this get converted into fatty acid. And fatty acid get converted into triglyceride later on. And this conversion and all this I'll be talking to you in the part 2. But as of now, we just learned one thing, that this acetyl coenzyme A, when it goes to road 1 and road A, ultimately it make the end product is triglyceride. So now the things are very easy. Glucose, acetyl coenzyme A, and we are getting triglyceride. I think most simplified version, and repeating second time. This I'll talking in much more detail in part 2. So let's come back to road 1. The road 1 first bifurcation was A. Now you go into bifurcation B. Let us see what it goes to. So B it make acetyl coenzyme A. It make acetoacetyl coenzyme A. Let me write it for you. So it make acetoacetyl coenzyme A. So this is made from the acetyl coenzyme A. Now what happened? Oh, so this is the route B, road 1, then we took right turn. A right turn goes to B. Oh, it reaches to what place? The destination reaches acetoacetyl coenzyme A. Yeah. Now this is converted into HMG-CoA. HMG-CoA. So acetoacetyl coenzyme A get converted into HMG-CoA. Well, we have reached this spot, HMG-CoA. Now the road B is going, and we reach up to HMG-CoA. Now this road B further divides into two parts. One is road C and other is road D. Let us see what is happened in road C. In road C, this is the one which divide into road C and it divide into road D. Road number C, road number D. Okay, so now we understood. Let's come back. So road number C, it get converted into mevalonate. It get converted into mevalonate. Road number C get converted into mevalonate, and which get converted into cholesterol later on. So this get converted to mevalonate, and this get converted into cholesterol. Well, now this step, this is road C. Road C, the final destination of road C is cholesterol. But when it get converted into from HMG-CoA to mevalonate, here what we need is HMG. Now that is very, very important enzyme. HMG coenzyme A reductase. This enzyme is essential to convert HMG-CoA into mevalonate. And this is the rate limiting step. Don't forget this, is very, very important. Don't forget this. This is a rate limiting step. And rate limiting step means it is this step. If you block it, if you block this step, that means there will be reduced synthesis of cholesterol. So friends, what we got here is HMG coenzyme A reductase. HMG coenzyme A reductase. And it is this which is blocked by the statins. It is this step which is blocked by statin. So this is a road. It is the so-called rate limiting step by which HMG-CoA is converted to mevalonate, and again repeating second time. It is this which is blocked by statin. It is a rate limiting step. So when we use statin, that leads to how the cholesterol synthesis is reduced. So we are clear about it. Again, a quick recap. We started from acetyl coenzyme A. It took road 1. Road 1 went to acetoacetyl coenzyme A, and it went to HMG coenzyme A. That bifurcate into two. One is mevalonate, and finally destination is cholesterol. Now let us see road D, which HMG-CoA is going to this thing. So road D is now, it is getting converted into HMG-CoA is converted into acetoacetate. So you can see it is getting converted into acetoacetate. Now this acetoacetate get converted into beta hydroxybutyrate. These are the two ketones, so-called ketogenesis. So finally we got ketones, we got it formed. So now So a quick recap of the entire metabolism that we studied so far. Quick recap. Number one, we started from what place? Glucose. And what was the destination we reached? Acetyl coenzyme A. Acetyl coenzyme A has two routes to follow. One route is to make citrate, and other route to follow. Now it goes to other route. It goes to other route. Route number 2, it follows. So in the route number 2, when it is following, so what is happening? Route number 2 goes, it again, route number 2 again bifurcate into 2 immediately. One route goes to make malonyl coenzyme A, and that is the final destination for triglyceride. Point to be noted. So one route is for triglyceride. Other route is for acetyl coenzyme A that make HMG-CoA. HMG-CoA final destination cholesterol or ketones, the 2 ketones. So the most keyword are number 1 glucose, second is acetyl coenzyme A, third is triglyceride, fourth is cholesterol, and the fifth one is ketones. Ketones are 2 acetoacetate and beta hydroxybutyrate. So they are the 5 keywords that you have to remember, and these things will again coming again and again, but basic foundation I made for you. With this background we move further, but well, we move further, we talk about fatty acid. Okay, fatty acid is there. Fatty acid synthesis occur and fatty acid degradation occurs. Yeah, well, it's a topic of the lipids, so I'll focus on fatty acid. We have in the body, in the mitochondria. Well, this is the cell. This is the cell. In the cell is mitochondria. In the mitochondria is citrate. We just read about it. Okay, and we also know that we got acetyl coenzyme A, we just read it. Citrate is a part of TCA cycle, and this citrate comes out and make acetyl coenzyme A, and this is done by citrate shuttle. Point to be noted, citrate is lying inside the mitochondria. This is the mitochondria, M is the mitochondria where the citrate is lying. Now citrate comes out and it make acetyl coenzyme A. Now this acetyl coenzyme A get converted to malonyl coenzyme A. I just mentioned to you, and this step need biotin, B for biotin, which I talked to you in the previous slide. CO2 combined and they malonyl coenzyme A that make fatty acid, and fatty acid is going to make triglyceride. This we learned it. So now if I correlate this slide with the previous one, so same thing, look into this slide. We talked about acetyl coenzyme A, and acetyl coenzyme A goes to malonyl coenzyme A and fatty acid. This is how fatty acid was synthesized, which is going to make triglyceride in the next step. So now fatty acid has been made, it has to get degradation also, it has to be broken down. So this fatty acid combined with coenzyme A, this is happening in the cytoplasm, and the enzyme uses fatty acid coenzyme A synthetase, and it will make fatty acyl coenzyme A will be made. Now it will enter the mitochondria, reverse. So this is entry by carnitine shuttle. Point to be noted, this is the mitochondria from which we have an exit gate and we have an in gate. So again, to make a very live, it's a question very simple. We go to any big building or hotel, there's an in, okay, in gate, and there's an out gate. It's written. That means if you want to enter the mitochondria, you have to enter via carnitine shuttle is the name of the in gate. The name of out gate is citrate shuttle. Both are shuttle, but it is citrate, and this is carnitine. So now this fatty acyl coenzyme may enter the mitochondria. In the mitochondria start beta oxidation, and ultimately beta oxidation will make acetyl coenzyme A. So now we got even acetyl coenzyme A is inside the cell, and that enter into TCA cycle and ketone bodies. I mentioned to you why ketone bodies are formed, and the TCA cycle is there from where citrate is getting generated. Definitely you must be surprised from where the citrate has come. So this is how the citrate come. So this is how the circle is completed. So with this small background of metabolism, okay, now these are all basic foundation which we'll be needing in the coming slides again and again. With this we move further. So this is a description of what I told you. You can write down. So as I told you, fatty acid metabolism. Fatty acid synthesis requires transport of citrate from mitochondria to cystole. The point I mentioned to you, now I have written also. So if you want, you can write down. So simply fatty acid synthesis required transport of citrate from mitochondria to the cystole or so-called cytoplasm. It's also known as cytoplasm. And now this sentence we knew, but where is the primarily this happened? It happened in three places: liver, lactating mammary gland, and the adipose tissue. Three things: liver, adipose tissues, and lactating mammary gland. There are three places. This is a very specialized place and occurs in ladies in a specialized timing during the time of lactation. So if I remove this for any male or female, now we are left with two tissues. One is liver and other is adipose tissue. So again, making a summary of the talk, that this fatty acid metabolism occur primarily in two organs, that is liver and adipose tissue. This I'll be talking in great detail in part 2. But again, at least you got the basic concept clear that site of fatty acid metabolism is in liver and adipose tissue. Okay. So the long chain fatty acid, they need carnitine shuttle. Remember, I told you the carnitine shuttle, which from where? That is the in gate of mitochondria, that is for long chain fatty acid. So what about short chain and medium chain? That I'll be coming in the coming slides. So a quick recap of fatty acid metabolism. It started from acetyl coenzyme A, and ultimately fatty acid was made, and of course citrate went out. Citrate went out and made fatty acid in the cytoplasm. Then fatty acid was degraded by entering into the mitochondria by carnitine shuttle, where it makes acetyl coenzyme A, which makes citrate, which enter the, which again start the cycle, and other is ketone formation. And ultimately what we read it, the site of fatty acid metabolism is liver and adipose tissue. Okay. Now, if this is, now let's talk about applied. Now we talk about applied medicine. If this carnitine shuttle is deficient, pediatric, so definitely the long chain fatty acid, they will not be able to enter. In other way around, we talked about mitochondria. We have a out gate, we have a in gate. This in gate is closed. So definitely the gate is closed. The long chain fatty acid cannot come in. There is lot of accumulation of fatty acid outside. Definitely the rush will be there. So then and ultimately, so that lead to toxic accumulation will happen, because it cannot. So outside the mitochondria, lot of fatty acid will accumulate. So it lead to weakness, hypotonia, non-specific. But don't forget hypoketotic hypoglycemia. Hypoketotic hypoglycemia is the classical feature that we see in these patients. Now, I talked to you regarding long chain fatty acid. So let's talk about medium chain fatty acid. Okay, they are again metabolized. So now if there is a deficiency of dehydrogenase, what will happen? So this is autosomal recessive disorder of fatty acid oxidation. Okay, so again problem of fatty acid oxidation. Now the fatty acid is not able to broken down. The problem is fatty acid cannot be broken down into acetyl coenzyme A. So it causes accumulation of 8 to 10 carbon fatty acyl carnitine in the blood. Point to be noted now, it is a medium chain 8 to 10 carbon fatty acid acyl carnitine. Acyl carnitine is there. Let's go back to the slide. Okay, come on. So when it did not enter, when it could not, the problem was at this particular place. That was so called, because this problem was, it could not enter. It could enter, but this is not able to broken down. This not able to broken down, so there is accumulation of fatty acyl coenzyme A is there. So this is the problem in the first step. The problem lies in the second step, is at this particular place, this will accumulate. This is a medium chain fatty acid molecule. So and again this will lead to hypoketotic hypoglycemia. Point to be noted, in both the condition, hypoketotic hypoglycemia is occurring. So this is the dehydrogenase deficiency, because this enzyme is involved in the breakdown of 8 to 10 carbon atom into further down into the acetyl coenzyme A. Well, it may present in early infancy or early childhood. Both are the pediatric disease. Vomiting will be there, lethargy, well, fatigue. Small child, otherwise small children are very active, but this is not an active child at all. Seizure, this and coma, this occurred due to hypoglycemia. Liver dysfunction can happen. Mild illness can lead to sudden death. Again, the reason being hypoglycemia. We all know very well. Whenever any illness occurs that needs lot of oxygen consumption and that needs lot of glucose also, fever causes increase in metabolic rate. But already sugar value is very low, so they can die because of severe hypoglycemia. So treat by avoiding fasting condition. No way these children should be kept for longer. Fasting, they should be regularly fed with something so that the fasting is not there. Now ketone bodies, we looked into ketone bodies, but again before I go, let me refresh your knowledge on the basic concept. We read about in this particular slide, lovely slide, and I told you that it is a acetyl coenzyme A get converted into acetoacetyl. This get converted into HMG-CoA. Now this HMG-CoA get converted to acetoacetate and beta hydroxybutyrate. This is ketogenesis, the point I just mentioned to you. But again, I wanted to refresh. But I want you to note down two things. One is acetoacetate and beta hydroxybutyrate. Well, we know there is something called acetone also, which is a part of ketones. So let's learn more about the ketones. more about the ketones, right? Ketones, ketone body, we read about biochemistry. In the liver and fatty acid and amino acid are metabolized to two acetoacetate and beta hydroxybutyrate. These are the two ketones, and they are used in muscle and brain for energy. Very, very important point. Can't afford to forget these two lines. Muscle and brain for two organs which we use, muscle and brain, they use ketone for energy. Now, what are the conditions which can lead to ketosis? Ketosis means excess of ketone are getting produced. Normal ketones are being produced. Ketosis means excess of ketone. High amount of ketone is there. That can lead to so-called ketosis, right? So if you look into the slide, the two important conditions which cause ketosis are prolonged starvation and diabetic ketoacidosis. Very, very important point. Point to be noted, prolonged starvation, patients not taking any glucose, and diabetic ketoacidosis itself can lead to a ketosis. But again, what is the biochemical base? Oxaloacetate is depleted, and in alcoholism, excess of NADH shunts oxaloacetate to malate. So ultimately, the main culprit molecule is oxaloacetate, which is the key molecule in the genesis of ketosis. Okay. Now, in both the conditions, there is a buildup of acetyl coenzyme A, and this acetyl coenzyme A, now it start making toward the ketone body and fatty acid, right? So fatty acid, glucose, fatty acid, everything, they are making ketones. This again you will not understand unless I go back to the basic to show you the actual what is happening. Look into this. That's why I say knowing basic is very, very essential. This is a lovely slide. I told you the acetyl coenzyme A go into road 1 and road 2. Road 1 and road 2. This road was acetyl coenzyme A. It was entering the TCA cycle. It makes citrate. Now you know how it was made. It was made inside the mitochondria. And ultimately, if you leave all these steps, ultimately they make is oxaloacetate. Oxaloacetate. The problem lies here. This is not getting metabolized. So definitely large amount of malate will be there. Large amount of citrate will be there. Simply the route is blocked here. Route is blocked, and that means everything is blocked. So whatever malate will be increased, citrate will be increased, acetyl coenzyme A will be increased. So now this acetyl coenzyme A will start making toward this route. This will start going into this route, and this how ketosis occur, because of back pressure. Simply back pressure. So now we learned about how ketones are getting made. What are the ketones we talked about? Just now I told you acetoacetate clear, hydroxybutyrate is clear, but there is something called acetone also. Acetone is how it is made. I'll just show you in the next slide. Now this acetone comes out of the in the breath. It is this which gives a fruity smell. Fruity odor, what happen is all due to fruity odor occurs due to acetone. So it goes out. It's not utilized in the body also. Okay. Now we do ketone bodies, and you check the urine. Urine test for ketone detect acetoacetate and only acetoacetate. This one, only this one. This goes out in the air, in the breath, so no chance of testing. Urine, and this urine test detect only acetoacetate. It does not detect beta hydroxybutyrate. Point to be noted, absence of acetoacetate in the urine does not rule out ketosis. Why? Well, this may be there, which is not getting detected by the routine tests. Okay. Now again, little bit more. Now with this will really clear your all the problems. So what I told you that we are getting lot of acetyl coenzyme A. Let us coenzyme A. Fatty acid. Let me focus fatty acid. Remember, fatty acid was degraded via carnitine shuttle. It entered the mitochondria that produce acetyl coenzyme A. We know. So now this acetyl coenzyme A normally can go into TCA cycle, or it can go into making HMG coenzyme A, and that HMG coenzyme A makes the acetoacetate. Now we are clear about it, how fatty acid is contributing into ketosis. And acetoacetate and beta hydroxybutyrate, they are getting produced in the liver. Now these two, point to noted, acetoacetate get converted into beta hydroxybutyrate. All is happening in the liver. Now from the liver, they both go to the blood. Acetoacetate also goes to the blood. Beta hydroxybutyrate also go to blood. Now they have come to the blood. In the blood, acetoacetate is converted into acetone, which goes out in the lungs, which I've been talking to you, which is the cause of fruity smell, especially in case of DKA. Now beta hydroxybutyrate, it may enter the extrahepatic tissue also. They can get and acetoacetate, and now this get again converted into acetoacetate. Acetoacetate, acetoacetate can go into acetyl coenzyme A, and finally acetyl coenzyme A is there in tricyclic cycle. So lot of interconnection is there. You need little time to spend more on biochemistry, although I made a beautiful basic, made a clear fundamentals of how these three. So this goes out. These two are in the blood, which are filtered in the urine also. We can detect acetoacetate. We cannot detect this in urine testing. So little bit more about metabolic fuel use. 1 gram of protein give you 4 calories, 1 gram of fat give you 9 calories, 1 gram of alcohol give you 7 calories. So cholesterol synthesis, we learned a quick recap. It was acetyl coenzyme A getting converted into HMG CoA, and that HMG CoA was converted into mevalonate, and this mevalonate get converted into cholesterol. And we also know that acetyl coenzyme A getting converted into mevalonate need HMG coenzyme A reductase. We read it, and it is this step which is a rate limiting step. It is statin act here. I'm just repeating for you. And this goes into cholesterol. Cholesterol is usually written as CH. So this is how the cholesterol is getting synthesis is occurring. So we come back. So now what the use of cholesterol? It is used to maintain cell membrane integrity. It's a very, very important part of cell membrane. It's also used to synthesize bile acid. This synthesis occurs in the liver. Steroid, vitamin D, androgen and aldosterone. All these occur in the adrenal gland. Okay, they're all ultimately, and this is the bile acid which occurs in the liver. So they are the uses of cholesterol. So what I told you, the thing HMG coenzyme A reductase convert HMG CoA to mevalonate is a rate limiting step. This point you already have written. And I also mentioned to you that statin, like atorvastatin, they competitively and reversibly inhibit HMG coenzyme A reductase. The point you already have written, but now at least your concepts are very clear how cholesterol synthesis is inhibited by statin at the rate limiting step. Now, this much we know that cholesterol is made, but what happened to cholesterol? Let's go into the next step. 2/3 of plasma cholesterol is esterified by lecithin cholesterol acyl transferase, so-called LCAT. I'll be talking about this in the coming slides. So, but the cholesterol part again I'll be touching in the next slide also, because this is the core foundation of lipid metabolism, that fatty acid, triglyceride and cholesterol. Three things: fatty acid, cholesterol and triglyceride. Okay, so these are the three things which are very important for the lipid, and this I'll be discussing again and again in the coming slides. So a simple, very brief outline I'll touch to make the foundation for the next lecture very strong. We have a dietary fat. In the diet, again, when we talk about dietary fat, it is mainly triglyceride. Cholesterol is also there, but mainly triglyceride. Remember, if they don't talk about anything, when they say dietary fat, means it is understood they are talking about triglyceride. Triglyceride again broken down, taken by intestine, and they make chylomicron. Chylomicron, they come to the circulation. This is a detailed cycle. I'll be coming in much more detail in the coming slides, in the coming lecture to be more precise, but a brief outline. Now this chylomicron is converted into by lipoprotein lipase. LPL stand for lipoprotein lipase. And this will, remember, this cholesterol contains triglyceride, little bit more now. So I talked to you regarding that triglyceride is a dietary fat. In the intestine, it is broken down into fatty acid and glycerol. They are absorbed by the intestinal cell. Of course, no need to say, in the diet, it's a pancreatic lipase. You can note PL stand for pancreatic lipase or simple lipase, which break down triglyceride into the fatty acid and glycerol. That we know very well. We read in our school days also that amylase break down carbohydrate, lipase break down the fat. Now we are well aware it's a triglyceride. So these two have been made in the intestinal mucosa, and now they are absorbed by the intestinal cell. They have come to the intestinal cell, fatty acid and glycerol. In this intestinal cell, they again combine to make triglyceride. Come on. So they again unite the two friends. Triglyceride, it may bifurcate into two. They come to the intestinal cell. They again unite to make triglyceride. It is packed in chylomicron. What I want to convey the message is this chylomicron, which is there in circulation, contain triglyceride. This we learned it. Now lipoprotein lipase, it break down some of the triglyceride into fatty acid. Again, same story. So definitely suppose this has 100 molecule of triglyceride, and say 30 triglyceride are broken down into free fatty acid. Now that means whatever molecule left is chylomicron remnant. It contains how many molecule of triglyceride? 70. So that contain lesser amount of triglyceride into chylomicron as compared to chylomicron. So chylomicron and this chylomicron remnant, this goes into liver. And this goes into adipose fatty acid. This goes into fatty acid as an adipose tissue, what I discussed earlier also. Okay, so point to be noted, the free fatty acid is getting utilized by the adipose tissue. Detail I'll talk in the next part. So enzyme involved in lipid metabolism, lipopancreatic lipase, I just mentioned to you. It degrades dietary triglyceride in the small intestine. What are made? Fatty acid plus glycerol. They get combined, they make a chylomicron. In the chylomicron, triglyceride is there which come in the circulation. So lipoprotein lipase, you remember just now, this lipoprotein lipase that break down triglyceride in circulating chylomicron, which I just mentioned to you. But very soon I'll be talking to you that triglyceride is there in VLDL also. VLDL, what is this? Let's go back to basics. So one triglyceride was in the from the GIT, which comes to the blood. Ultimately in the liver also we are getting liver also synthesizes triglyceride. Liver also synthesizes triglyceride. It means for our body we have two sources of triglyceride. One is the liver synthesis, in-house synthesis, and other is we are importing from outside, that is diet. Well, and we also know that this dietary fat enter into circulation via chylomicron. So whatever triglyceride is made in the liver, it goes out in the form of VLDL. Oh, the VLDL again contain triglyceride. And what happened to this? I'll be talking to you later on. So one thing is very clear, we have two molecules which are rich of triglyceride. One is chylomicron, one is VLDL. So VLDL also contain triglyceride, again broken down by LPL. So LPL break down triglyceride of chylomicron as well as VLDL. And here it make IDL, intermediate density lipoprotein. Here it was chylomicron remnant. Chylomicron remnant went to the liver. Even IDL can go back to liver. Come on. So they find liver is a good place, go there. They give some amount of triglyceride, okay, but even chylomicron gives some amount of triglyceride, remaining he take to the liver. Even this VLDL, okay, again it make IDL say, come on, take little bit of fatty acid and let me go back to liver and let me relax there. I'll spend a good evening time having a drink in the liver, comfortable. And done. It is all lipoprotein lipase, fatty acid was made and goes to liver. Or it could goes to adipose tissue. Good. Now, so ultimately we are clear about it. Then this IDL get converted to LDL also, low density lipoprotein. This is done by the hepatic lipase. This is done by hepatic lipase and that convert into LDL. And this LDL can go back to the liver or can go into peripheral tissues. So this is the basic summary. Lovely. A quick recap. Chylomicron and VLDL, they contain what? Triglyceride. They are broken down by which enzyme? Lipoprotein lipase. Chylomicron is converted into chylomicron remnant and VLDL is converted into IDL. Chylomicron remnant and IDL may return to liver, but IDL can get broken down into cholesterol into LDL by the HL, hepatic lipase. Now LDL can again come back to the liver or can go into peripheral tissues. Okay, what is going to in the peripheral tissue, that I'll be talking in part 2. Okay, we have one more hormone sensitive lipase which degrade triglycerides stored in the adipose site. One point I've been talking to you that even the adipose tissue is a source where triglycerides are stored, and from there it is by hormone sensitive lipase. So other than the pancreatic lipase which is in the intestine, in the blood we have three things. We have got LPL, then we have HL, and we have hormone sensitive lipase. Three lipase they are in the circulation also. All these they are going to break down triglyceride. LCAT I mentioned to you. What I mentioned to you that ultimately cholesterol is esterified by esterification done by LCAT. So let's see. We got in the liver and intestine, we have lipid, and that is made into nascent HDL. And this nascent HDL is made into mature LDL by LCAT. That means it is causing maturation of nascent LDL, which is immature HDL. Mature LDL is HDL by LCAT. And now this HDL, get converted into cholesterol ester to VLDL, IDL, LDL. This is done by CETP. This again is simple one line I told you. The basic and all these detail I'll be talking to you in the coming part 2. So at least when you enter the part 2, you know there are two things. One is LCAT and CETP, which is converted into immature HDL into mature HDL, and this is getting converted. It transfers, remember, it transferring cholesterol to VLDL, IDL and LDL, which we have read it, which they are all source of good amount of triglyceride is there. But now cholesterol will be entering from this via LCAT and via CETP. Okay. So I hope the concepts are clear to you. Thank you very much. God bless all of you.